or gain of function of oncogene in development of cancer. You can think about this as a general model for the interaction between the tumor suppressor gene and oncogene in the development of cancer. Now we'll go into the mechanism of viral oncogenesis, what viruses has to do with these things. Oncogenic viruses cause up to 20% of all human cancer. It can induce carcinogenesis either directly or indirect. Direct, certain viruses like Epstein-Barr, Kaposi sarcoma, human papilloma, as we will see, the human T lymphotropic virus 1, all these are they interact directly with the cell mechanism of division and apoptosis. So they have something to do. They have specific component in their proteins composition, genome composition of those viruses that interact or dysregulate cell cycle or dysregulate apoptosis and so on, that they directly induce carcinogenesis. Indirect, as the case with the hepatitis, viral hepatitis C and B, this is result from chronic liver inflammation. Chronic liver inflammation eventually lead to hepatocellular carcinoma, but they don't have an identifiable, clear mechanism for carcinogenesis. It's just due to an inflammation. You can see here a list of viruses. You don't have to memorize these. Just remember to know the viruses can be a really significant factor of carcinogenesis. See, Epstein-Barr, up to 40% of Hodgkin lymphoma comes from Epstein-Barr. Up to 99% of adult T cell leukemia is due to human T lymphotropic virus 1. Up to 95% cervical carcinoma due to human papilloma, and so on. So you can see that viruses are really a significant and powerful causative agent for carcinogenesis and tumors. Mechanism of viral oncogenesis, they have certain proteins targeting tumor suppressor pathways. They can target host signaling pathways, as we mentioned with the kinases, exploiting the host DNA damage response, dysregulate or disengage DNA damage response, or it can manipulate the host immune response, particularly those that allow them to stay in the cell and mess with the cell division and cell proliferation mechanism or cell cycle mechanism and apoptosis. You can see an example here. So this is the main ones that we've talked about, retinoblastoma and P53. And all these are viral proteins, right? All these are viral proteins. Again, you don't have to remember these, but you can see, for example, human papillomavirus protein E6. This one works directly with P53, inhibit their function. Kaposi sarcoma, Epstein-Barr, hepatitis B, so on. Some of them, they work upstream in the signaling cascade. The same thing, HTLV1, for example, works with certain signaling pathways. Some of them, they induce or interfere with signaling pathways for certain critical function inside the cell, like autophagy, like ribosomal protein synthesis, and so on. But mostly what we are concerned here, or mostly focusing on those that has direct interaction with the cell cycle regulator, for example, tumor suppressor G. So this is just for illustration, just to know that there are a lot of viral proteins that they interact with the regulator of cell cycle and therefore potentially can cause cancer. Now we'll briefly describe the human papillomavirus as one of those viruses that can cause cancer with a specific mechanism. It can cause sexual transmitted infections, commonest viral infection of reproductive tract, skin to skin genital contact is well recognizable mode of transmission. Majority of HPV type are harmless. Infection clear up without intervention in a few months. 90% infection clear within 2 years. Small fraction of infection persist. And this is the problem. Persistence is what potentially progresses to cervical cancer. right? Small fraction of those will persist. Persistence means chronic infection. And that's what allows to interact more with the cell cycle regulators, proteins, and tumor suppressor genes, and therefore eventually causing cancer. Cervical cancer is the most common HPV disease, nearly responsible for all cases. So human papillomavirus is responsible for all cases, or almost all cases of human papillomavirus disease. Type 16 and 18 for 70% of cervical cancer. Others are less. Cervical cancer, of course, it develops over years. You need chronicity over a couple of decades in order to result in carcinogenesis or tumorigenesis. Cervical cancer is the fourth frequent in women, over 500,000 new cases in 2018, approximately 300,000 deaths. 75% of all female cancer deaths is due to human papillomavirus. And that's because it has a specific mechanism of causing carcinogenesis. Screening is effective, allow early detection of treatable precancerous lesion stage. Early treatment prevent up to 80%. That's why there's treatment, there's vaccine now. First to be vaccinated against HPV, women to get screened regularly. Protective vaccine against those types, high-risk types 16 and 18, work best if administered prior to exposure. And WHO recommends to vaccine girls 9 to 14 years old. Now, this is what happened. The virus is introduced into the cervix. It enters the cell, the epithelial cells replicate inside, stay there silent, away from the immune response. It hides, it continues to replicate for decades, 10, 20, 30 years. And then, of course, during this replication, excuse me, during this replication, the HPV DNA is integrated in the tumor cell. And this integration what causes or develop and helping developing cancer. Because now when you have this DNA integrated, a lot of viral proteins will be produced, and these proteins interact with the mechanism of cell cycle, regulatory mechanism and apoptosis, and therefore it allows the cell to preferably go for replication and proliferation, whether or not there is a DNA damage, because it dysregulates, it disengages this mechanism. We'll see what happens. So this is an illustration of exactly how the human papillomavirus protein works with the cell cycle regulators. So this is in the normal case where there is, as we mentioned, retinoblastoma. You remember retinoblastoma bound to elongation factor, so the brakes here is working. Elongation factor is going to induce the gene transcription once the retinoblastoma is phosphorylated. So once retinoblastoma is phosphorylated, that means the elongation factor can go and induce transition from G1 to space. On the other side, the P53 works on another protein called P21, which works as a negative regulator of G2 to M transition. So both of them are negative regulators. So you need to phosphorylate RB in order to drive this, and you need to inhibit P53 in order to release the inhibitor and therefore drive G2M transition from this side. So what happened during HPV virus infection? We see that this protein, E7 in this side and E6 in this side. These are viral protein produced by human papilloma. It binds to retinoblastoma directly, and it induces its degradation, which means now I don't have the brakes. The brakes are gone. So elongation factor will work uncontrollably, allowing a transition to go even unchecked for the damage, unchecked for condition, it will drive transition. It will increase the speed of transition from G1 to S, which means more proliferation. On the other side, we have another protein called E6, also produced by human papillomavirus. This one binds to P53 and induce its degradation. Now I don't have the break on this side too. If I don't have the break, then the brake is not working, and therefore the acceleration of G2 to M transition is increased. So in both sides, we are pushing the cell to accelerate in their division. That's fine if there is no mutation. But the problem is, we know with this speed of cell division, there is always inevitable events that allow the mutation to arise. Either damage in the DNA, damage in the chromosome, insufficient number of growth factors, nutrients, size, and so on. All these problems will happen. Of course, we mentioned several functions of protein-class, several functions of P53. Both now are disabled, so the cycle will go. So here, the gas pedal is going without brakes, because the brakes are degraded or disengaged by a specific interaction with viral proteins. So this is just a brief example of how one of the viruses can interfere with the life cycle and cause carcinogenesis or tumorigenesis. So that's all, and this is the description of the diagram if you need to understand more. So that's all. I apologize for delaying the delivery of this session, just for I was a bit sick the last week of Ramadan, and up until now was just able to make it. So just focus on the main messages, on the main ideas. No details here. I will not ask you to remember the names of the proteins, E6, E7, or P53, or just know that there are mechanisms of cell cycle regulation and how these mechanisms are interrupted by certain viral protein, and therefore it can produce carcinogenesis. So best of luck. If you have any question, please either through my phone or email. I try to reply as soon as I can. Best of luck. Assalamu alaikum.